Mothers are not dying because we don't know what kills them. Mothers are not dying because we don't have the expertise. Mothers are not dying because we don't have the know-how. Mothers are dying because we have not come collectively as a community, as a society, to ensure that no mother dies when they are giving life.
And currently, Doctor, you have this talk about mothers across the country not being able to access services because they are not able to meet that financial aspect of this. What can you say as a country? We've seen even a section of mothers across the country, some locked in delivery rooms. What could you say about that? And what are the solutions to this?
Our financing, of course, is the greatest transformative agenda that we have undertaken as a country, moving from National Health Insurance Fund to the Social Health Authority. And in terms of Social Health Authority, we are talking about social health insurance, which means that you leave nobody behind and ensure that you pay according to your means. The ministry has gone out of its way to be able to discuss with development partners, and we have accessed funding to be able to assist mothers who may not be able to pay for their premiums. You saw last week in State House, His Excellency, the President launched a scheme to be able to pay premiums for indigents to the tune of 1.5 million healthcare workers. So we are working with SHA, we are working with the facilities to ensure that no mother is denied a service simply because she cannot be able to pay for social health insurance. Indeed, even teenage mothers who may not have the requisite identification materials, there's a platform that we have opened up under the Digital Health Agency to ensure that they can be registered either with a birth certificate, but also with even an ID of a guardian to ensure that they receive the service.
And how soon will that be actualized? And my second question, blood shortage in the country is a perennial problem. What is the government doing to address it?
That's one of the teenage mothers is already being implemented across the country. The money is available. That's of almost 900 million Kenya shillings. And we are working closely with the counties to ensure that any teenage mother who comes to register, whether they have an identification material or not, then they are onboarded. In terms of blood, yes, blood has been a problem because of our donation culture as a country. We are supposed to collect about 500,000 units of blood, about 1% of our population. But that has not been the case. And therefore, we are working very, very closely with the counties, with the civil society organizations, with other implementing partners, including Red Cross, to change our donation culture so that we can be able to see that we donate the required amount of blood that can be able to sufficiently serve our population. There's no replacement for blood. If you require transfusion, it is that blood that will be able to save a life. So it is a call to action for all of us to be able to embrace a donation culture so that we have sufficient quantities of blood. We have the necessary policies, guidelines in place to be able to support the counties and ensure that we collect sufficient amount of blood. We are also working with the National Treasury to be able to increase the allocation, financial allocation, and we are expanding the space of the blood ecosystem by establishing regional blood transfusion centers. Now we want to have transfusion centers literally in each and every county in this country so that every county can be stocked with adequate quantities of blood in case there is need for use.
Sorry, Gigi, I'll take you back to my previous question. Are you saying that from now henceforth, if teenage mothers go to...
I am not saying from now henceforth. I'm saying that is what is actually working at the moment. Yeah.